Hey everyone, this is just a quick tutorial on how we've been doing remote progress checks using the NeuroVisual Trainer software. Just going to demonstrate it to you. There's some variations that you can do on this particular sequence, but I'll show you what's been working for us. We've done a number of progress checks this way thus far, and we've had some good feedback for sure, and the results have been helpful for guiding the vision therapy experience. So as you can see, I'm logged in here into just a test clinic, and underneath this particular area here where patients are assigned, you can see your list of patients. So we have here Robert M. So this is the individual I'm going to be designing a progress check for. So generally these patients will be assigned to their active vision therapist, and underneath this section here you can see that there will be exercises that are assigned. So the day before the progress check, I'll get a message from the acting vision therapist that we have a progress check coming in, and I'm going to go into this section, assign exercises, and I'm going to be creating a template of exercises that I'm going to want the patient to do in front of me while I'm working with them remotely online via Zoom or Skype or Google Hangouts or whatever system you've been finding to be working. So again, in assign exercise, what you'll see for Robert here, these are the activities that he might have been working through this week. Binocular accommodative rock, anaglyph chart walk backs, C3 coins, saccades. So I'm going to remove his active exercises, and I'm going to add in a sequence of exercises that I'd like to see him do while observing him online. So for special instructions, we've been writing a bit of a template here. Hi Robert, this sequence of activities will be used as a remote progress check. Once we connect online, you will need to work through all 5 activities prescribed in order, and we will compare the results with all the great gains we've been seeing with you thus far. So the sequence that we've been using, initially we've been choosing categories from the interactive exercises. So the first one that we've been adding, we've been taking a look at saccades. So the saccadic activity here, I've been finding level 3 is a good point, or a good good level to assess progress. You can vary this depending on how they've been performing thus far in therapy, but it's been a good starting point. The duration I've been setting to 45 seconds, and I'd like them to do it using the anaglyph glasses just to add a little bit of extra demand. So I'm going to save that activity. The next activity I'd like for Robert here is going to be called line tracing. So this is kind of like our Groffman visual tracing activity. So line tracing, the setting that I've found, again, level 3 I've found has been working well, and I've been setting it for 5 rounds. So we'll save that here. The third activity that I've been using is visual memory. So again, they'll be presented with a shape, and they'll have to locate that shape amongst a number of similar shapes. Starting point, again, I've been using level 3. You can vary this, but I've found that that's been a good level for progress checks, and I'll do it for 10 rounds. I'm going to save that. For the next activity, the next series of activities, I'm going to be looking at their vergence ranges. So interactive exercises, I've been going to random convergence base out. Duration, I found a minute has been a pretty good time frame. Separation, 1 prism diopter. Interactive exercise now for random divergence base in. Again, I'm going to set this at about 1 minute. You can vary the duration generally. I'm going to keep the separation size at a 1/2 prism diopter. All of this is variable within the program. If you're assigning vision therapy activities, I've just been keeping it at about at these settings for progress checks. And then finally, what I'm going to add is a little bit of jump vergence. So random jump vergence in and out. And I've been liking to set this at about 1 minute or so as well. Separation 0.5 has been working thus far. So I'm saving this sequence of activities here. You can see there's actually 6 activities, so I'm going to have to adjust this here. All 6 activities prescribed in orders: saccades, line tracing, visual memory, base out, base in, and jump vergence. And I'll save these exercises. for the patient. And so now the exercises have been updated. You can see down here. So what's going to happen is now when I remotely connect with Robert, I'll go to his view. I'm going to have him connect with us again via Zoom or whatever system you're using. And I'm going to initially talk to him about his results, his experience, his case history, maybe have him do some eye control movements for me to observe and see, maybe a red-green near point of convergence, accommodative facility. We have a lot of prisms out there with our patients, so I might do just a free space vergence activity with a prism and try and get a sense of how he's performing. And then I'm going to ask him to log into the software. And this is what it'll look like. So you can see view application as Robert. So you can see here he's getting, this is what it'll look like on his side. So again, the note that I had said, this sequence will act as a remote progress check. And then I'm going to ask him to work through the activities. So first, this saccade level 3, put on the red-blue glasses. We're going to start the activity. And again, this will be, he's going to be wearing the glasses in different directions. So I won't go through the activity, but you'll get a sense that's how saccades will work for, again, 45 seconds. Line tracing, again, we have this set at level 3. So you're going to want him to use his eyes to, it's a little bit outside of the screen here that I've recorded, but where my arrow is, there's a green arrow pointing for them to follow this line with just their eyes. And they're going to point down to the number that it ends up at. So see if you hear that. So it goes to 3, and then they'll follow this through and they'll press the number that the line comes out at. So I have them doing this for about 5 rounds. Next, we'll do the visual memory activity, or I'll ask Robert to do the visual memory. Again, level 3, so you can see this is going to get started. They'll stare at the dot, and you'll see this sequence of activities. Good. So they're going to click where they thought that was. And it'll repeat again for 10 rounds. Finally, for the vergence sequence, we're going to start with base out. So again, they're wearing their red-blue glasses. And they're going to work through your traditional vergence activities for base out separation. Now we're going to do a divergence activity here. So you can see it's separating the opposite way. And finally, we'll do a bit of a jump vergence activity. So alternating between base out and base in. So I don't have the glasses on, so I'm not doing very well, but that'll give our jump vergence. So from there, I can go back into, now I'm back into my screen. So I'm watching them as they do these activities. And if they had gone through the entire sequence, what you'll see is a little progress report gets generated. So you can see here, he didn't finish the activity, so we didn't get a full outline of the scores here. These are what he was doing in vision therapy, but you'll get a breakdown, and the results that you'll get will appear like this. So saccades, you'll get the number that they got correct and the percentage correct. Line tracing, you'll get the number correct, the percentage correct, and the amount of time it took them. Visual memory, you'll get number correct, percentage correct, and time taken. Randot convergence for a minute, you'll get separation diopters, so base out. Divergence set for a minute, you'll get separation diopters or base in. And jump vergence set for a minute, you'll be able to see what their base in and base out ranges are. So it gives you, a nice idea of how the person is performing. It's also some objective data that you can use in your progress reports. You can tailor the remainder of your program based on these findings. And again, the nice thing about the progress check is this is a generic sequence. You can adjust that. You can adjust the activities that you want to do with the individual based on some of the interactive exercises that are available. So this is how we've been doing a progress check, and I hope that it's helpful.